This is Nancy Lee, and the Sloan Kettering group did an amazing job looking at a biomarker-directed therapy for HPV-associated oropharynx cancer, trying to reduce the intensity of the radiation based on the biomarker. So they use this beautiful fancy PET scan called an F-meso scanner, which looks at hypoxia, how much blood is in the tumor and oxygen is in the tumor. And they found that if the tumor has lots of blood and lots of oxygen, they do really, really well. And you can cure them with much lower doses. Instead of doing 7 weeks of radiation, they did 3 weeks of radiation, and they stopped. And their outcomes were incredible. The cure rates are incredible. Those patients who on this fancy scan that they did beforehand, the F-meso scan before and during the middle of radiation after 3 weeks, if they still had hypoxia, if they still had evidence that there wasn't enough blood flow, that it was a necrotic tumor, they continued to the high dose of 70 gray or 7 weeks of standard radiation. And what they were able to show, of almost 80% of patients, they were able to reduce the amount of radiation they gave by more than half of the dose, dramatically reducing side effects, inconvenience for patients. It is a complete game changer. The best news about this is their initial results are now being translated into a randomized phase 3 study that has FDA oversight, that if it turns positive, we will be able to get, hopefully, the F-meso scan, which none of us can get because it's not approved, it's very expensive. If they do this follow-up phase 3 study, the F-meso scan will be able to be approved, and hopefully we can actually all start utilizing this scan and change the way we treat people based on this approach.